Dr. Udani. It's so nice to have you here. Okay, so I think we'll get going then. How about that?
Yeah, let's keep it really nice and fun. Let's make it comfortable so everyone can join in if they feel like they can. We'll have a conversation and hopefully learn a lot of things.
Yay! And I know you have a lot to teach, so I'm excited. Okay, everyone, welcome to the Inspiring Insights video webinar series. So glad to have you here. If you haven't tuned in at all before, welcome. I do appreciate your interactivity and your engagement as much as we can. And we do, the fabulous practitioners and health providers that we host are also looking for that. They're looking for exactly what people are interested in and what they're, in their scope of knowledge and in their kind of their truest self and their truest knowledge. How can they help you the most? So Inspiring Insights is brought to you by the company that I co-founded, which actually we're in the process of changing the name to, and I'm going to be fully transparent about that because we want to commit to being more anti-oppressive and anti-racist. And so we are in the process of changing our name, so stay tuned for that. But for now, the Inspiring Insights name will stay the same for this webinar series. So basically, we are an online education platform that helps people navigate the alternative wellness sphere, whether that be someone seeking out care, in the chiropractic or naturopathic or massage therapy realm or physio realm, or, even something a little bit more woo-woo, quote unquote, like an astrologer or, a Reiki practitioner, which is, these kinds of modalities are actually becoming a lot more mainstream now, and they're really helpful. And we recognize that. And we don't always think that, emergency medicine and the medical framework is very, very good for us. But we're just looking to highlight the alternative wellness sphere and how we can really help you navigate that, because there currently is really no framework for that for women. So, and as women, I think we are the ones that access care the most. And we're also the ones that, tend to face gender-based violence and discrimination as we navigate that. So, we're here to not so much do some hand-holding, but just be, the gentle guides to direct people where they need to go and how they can really help themselves in the process. So yeah, we're really looking to, inspire a more conscious world. And I think it starts with women's empowerment and women education. So thank you for just hearing me out on that. And we'll get right down to it. So today we are hosting Dr. Udani. Thank you so much for being here, Udani. It's a pleasure to see you through the camera virtually. I'm so happy we can connect again. Let's just read a little bit about Udani and what her approach to medicine is and how she can really help her clients. So Dr. Udani is a registered and naturopathic doctor in good standing here in the province of Ontario. And she has a very particular special health interest in women's health, in digestive issues, in chronic pain, in stress, cardio-metabolic conditions, and skin conditions. So, I was really interested in her to come on here and talk about today, the connection really between our skin and everything that we put inside our bodies, whether that be makeup that we absorb through our skin or through the food that we eat. And we're going to get really, really into, the skin microbiome, some healthier or more natural, less toxic makeups that we can use, ways to decrease your toxic load from, pesticides and heavy metals from the food that you're eating and everything in between. So I'm so happy, Dr. Udani, to have you.
Thank you so much. I'm so excited to be here and share all these wonderful things. And I want to say hi to Hazel. I see that she messaged. Thank you for joining us. And I'm ready to get started.
Amazing. Amazing. Yeah. Thank you so much, Hazel, for your comment. For anyone else who's joining, please just write in the comments below. We love your interactivity, and we love to see where you're tuning in from, if you're close or if you're far. And our question for you today is, have you noticed any foods that give your skin flare-ups in particular? Because a lot of the times we have, you know, some habits that we do, maybe, you know, the bag of chips that we eat when we're watching Netflix, you know, trying to chill or whatever. And perfect. Yeah, you're in Toronto. Great. So there's a lot of things that, you know, we could avoid or maybe beautify our skin with in different sort of snacks and other things. So yeah, Dr. Udani, why don't I guess I was really interested in you just kind of sharing your story and really how you got into skin conditions and why that means so much to you in your own practice.
So I personally, I experienced a lot of skin issues as well when I was growing up, especially going through puberty. I think I got my first breakout when I was 11 years old. I specifically remember that day too, because I was so stressed, and that stress reaction and just seeing these breakouts come in, I wasn't able to link food and what I ate at that time. But as I got older, I realized that there was certain patterns. You know, if I was eating the dairy, a lot of sweets, a lot of chocolate, I would end up getting more breakouts. So when I started to cut that down, it went away and it became more manageable. And then I realized a lot of people these days, they are kind of going through life, maybe experiencing a lot of skin conditions and not necessarily seeing all these links like I was, you know, when I was younger. And I was just telling to my patients, there is a deeper connection. You know, our skin is a reflection of what is going on the inside. And it is our biggest organ. You know, it is one of the most formidable, amazing organs that, you know, protects us from so many things. It's so complex, but it is so affected by what's going on the inside. So that's why I did lots of research and really see what are some ways that can help our skin by fixing the insides or helping the insides get healed. Hi, Caitlin. Want to say hi to you as well.
Wow, I love that. Thank you for that, because that is a story that is really not uncommon, you know, for a lot of folks our age. I think maybe even for a lot of other people in other age and categories and age generations. It's something so, you know, it really truly is a marker of our health, you know, how one's skin really looks and feels, and you know, just in general, like, you know, it's so funny how people really have like a lot of issues with skin, and you know, how our system really has no way of kind of identifying what that means. You know, a lot of people who, when they break out, they think it's like allergies, or, you know, they think it's because of something, you know, touching their face. And I want you to speak to that too, because maybe there is something in that. I don't know.
I agree. So a lot of it can be complicated. You know, there's definitely a part where, you know, like if something comes into contact with your skin, so in conditions like contact dermatitis, for example. So if you wear, you know, like heavy metal, like rings or something like that has nickel in it, for example, your skin can get a reaction, right? Or if some people have a sensitivity to sunlight, for example, you might get excessive redness, or even some people even get hives, for example. These are all like external factors that directly affect skin. But then there's internal factors that kind of keep this low-grade inflammation, I like to call it. It's like a little fire. Think about it. You know, it's not like a forest fire. It's not huge, but there's little fires constantly going on underneath, and tiny thing just sparks it up, and you get this crazy reaction. So that's why it's really important to kind of look at the insides to see how can we calm this down? How can we improve things like inflammation so that we don't get these skin reactions? A lot of patients that I do see that have skin issues, they usually have something internally off. And a lot of times what, like, let's say, for example, conventional treatment is, you know, corticosteroid creams, you know, or antibacterial things for acne, for example. But a lot of times they don't really act on what's on the inside and what are the factors that can be causing this issue. So I personally believe a integrative way to look at skin is really important. Because, let's be honest, people care about when we look good, we feel good,
Mm-hmm.
And in that case, obviously, if we feel amazing from the inside, it shows on the outside too. So that's why it's so important for me personally, because I feel like when I see patients that have had so many skin conditions and they're seeing improvements, I can really see how their mood is uplifted, their mindset is better. And that really motivates me to just share the information and keep going and like to teach them that there's these links.
Wow. Yes, 100%. I see that, I used to work in a gym and very similar, even just the way that someone holds themselves, as they walk in the gym versus as they're walking out is so interesting to just witness that, they feel so much better. And I can't imagine how someone would feel after, months of really working on their diet, working on their nutrition, working on, maybe even their face washing routine or skin washing routine, changing their soaps, maybe changing their laundry detergent, has such a huge impact. And, all of that work culminates into something that it really shows on the outside, right?
Yes,
and
exactly.
It's so worth it. So worth it. And like, hands up for that. I'm all about that. That's amazing, Udani. Thank you. Now, like, can you share a little bit more? I'm wondering about like the actual specific gut skin connection and how that really relates to, the foods that we put inside us, how, some people I see are saying that they react to chocolate. Some people are saying that they react to deep fried foods. So what is that connection, as we ingest these foods, how does it automatically just come out in our skin?
So I always like to start off with a really easy example that shows the effect your gut has on skin. So let's say you have an allergy to certain foods, right? And you have peanuts, for example. You in that allergic reaction, you get the hives, right? That tells you if you eat something that you're allergic to, you will have something in the skin. So there's a connection already there with the gut and the skin. So these kind of foods so some of our viewers are saying like deep fried foods or chocolates, even if it doesn't show immediately, what it's doing is it's affecting, it could be the gut microbiome, so the gut bacteria that you have. It's affecting the hormones that could be released in response to these foods. So for example, chocolate, you get a lot of that insulin, spike because it's sugar. So our body's trying to get that blood sugar into our cells. So these are some of the factors that kind of modulate how our skin reacts to it. So the gut microbiome, let's start there. Gut microbiome is one of the biggest teachers of our immune system. So our immune system, most of that actually is in our gut. And let me tell you why. So one of the reasons is, if you think about our skin is about 7 cell layers thick. Okay, so it's like really big, huge, formidable, amazing, nothing really gets past it. But in our gut lining, it's only 1 cell layer thick. So imagine 1 cell layer, 1 cell compared to 7 cells. So the gut lining is so sensitive to being broken down. And in partly, that's why you have this big immune system right there, just to catch if anything comes through that gut lining. But because it's so easy to be broken down and so susceptible, if you're eating poor foods, or if you're eating foods rich with, or foods that are contaminated with lots of pesticide residues, for example, heavy metals, or if you have excess bad bacteria, this gut lining gets really easily damaged. So then you have this immune system overreaction, because the immune system's like, there's all these huge income of bacteria, these toxins coming in. I need to rev my system up. I need to keep fighting these. And there's inflammation, and the immune system, immune cells go all throughout your body. And one of the areas it deposits is in the skin. So when these really highly active, inflamed immune system reactions come in, you tend to notice some skin issues like eczema, psoriasis, or rosacea, for example. So there's been studies that's shown a huge immune system relationship in the progression of these diseases. So, if you, and And the big trigger that causes these things is the gut. You know, if your gut health is bad, then this immune system reaction is so rampant and it's continuous, and it tends to show up as flare-ups in the skin. So psoriasis and eczema and rosacea. And yeah, so that's why it's so important to look at the gut and find ways to heal it so that we don't get this crazy big immune reaction. Yes.
Wow.
So hopefully it wasn't super.
So let me just, I know for listeners, like you said, a lot of things that
right.
people may or may not understand. So
exactly.
What I'm hearing is, you know, say our digestive system is kind of like the pipes in the wall behind you. Okay. Right. So the same kind of thing where like, okay, one screw comes loose kind of thing. That's like just the one layer of cell, and that water can leak or whatever else. And it comes out onto the, you know, the wall behind you, and then you notice there's a leak, right? And that's kind of similar, I guess, in what you're saying in terms of like how, so there's this one layer of cells between your digestive tract and your immune system. And then the immune system actually goes beyond that and deposits that, you know, that leak into your skin.
More or less, yes. So,
okay.
Yes. So yes, it is like, so the immune system can actually go through the gut lining. It's like this shows up as little antennas to sense what's going on the outside world, right? So if you think about this, the gut as a tube, whatever is in that tube is the outside world because we were eating it and everything. So immune system can kind of put in these little antennas in to see, to sense, okay, is everything is great in the outside? How is everything going on? So if, let's say we're eating a poor diet or we have microbial overload, so too many bad bacteria in our gut, immune system senses as being bad world out there, you know, in a sense. So then it tends to kind of go on this hyperdrive. And one of the other organs that where it has a pretty strong connection is the skin. So it might show up on the skin as an overreaction.
Right. Okay. So cool. So yeah. Okay. That's good. That's good clarification. And then that skin is just almost one way of showing it, right?
Yeah.
So there's all these other ways, you know, of constipation, diarrhea,
right? Diarrhea,
perhaps, you know, joint aching, aches, pains, headaches. Okay.
There's so many different symptoms you can get. You can get brain fog. You know, you can even get joint pains, like you mentioned. A lot of things.
Okay. Nice. Okay. Does that clarify for folks? Yeah, I think that was good. That was amazing. And I just want everyone to, you know, to want to make sure that everyone understands. And so you mentioned the gut microbiome, and I think a lot of us equate, you know, the bacteria or, you know, quote unquote bad bacteria, because I don't know if there's any real such thing as like, you know, super bad bacteria, but I think, can you speak to that in terms of like, you know, what foods may or may not cause an accumulation of certain bacteria that cause issues?
Right. So what's really important is the diversity. So you need to have not just one or two specific strains. You need to have multiple. Think of it as a rainforest. So the strength of a rainforest is its diversity, right? Because it's able to communicate with each other. It's able to be resilient and just like adapt to things. So just like that, our gut microbiome needs to be diverse. So yes, there will be bad bacteria. There's going to be good bacteria. What's important is to have that balance and not too many of the bad guys or too many of the good guys. So what I mean by bad guys, so they're not necessarily out to get you all the time. They're only out to get you when it seems like there's all this opportunity. So when we think about the standard North American diet, for example, you know, a lot of high carbs, a lot of processed foods, that tends to not do so well with the diversity in our microbiome. You know, it tends to like kind of cut it down really badly. So then the opportunistic guys, the bad bacteria tends to overgrow in those conditions. And then that's when they kind of get too loose and they start to, release all these toxins. And that's when we might get that bloating, we might get constipation, get the diarrhea, sometimes even get weight gain because of this imbalance. So that's why diet can be really important to maintain that diversity of the microbiome.
Okay. And yeah, that I understand. Perfect. So is there such thing, like I know that you mentioned before that the skin also has a microbiome?
Yes. So skin is, it's been almost not, I don't want to say super old, but it's been recently discovered that there's a skin microbiome that exists as well. So there's different, they found is that there's different species of bacteria in different parts of the body. So, let's say for your armpits where you sweat a lot, you tend to get bacteria that produce more of certain compounds compared to on your face. So there's diversity in skin as well. And that's why it's so important to maintain this diversity. So what they found for patients that have acne is that there's a decreased diversity in the skin, which leads to overgrowth of the acne-causing bacteria. So then you get those acne lesions. Same thing with patients that have eczema, for example. What they found is there's a reduced diversity that led to an overgrowth of Staphylococcus bacteria. So this bacteria is really, it's everywhere. But when, when there's no diversity, it kind of takes over and becomes a bad guy and starts to produce these really harmful toxins. So you get those excessive skin peelings and flare-ups and things. So there's definitely a skin microbiome, and it's really important to maintain your skin microbiome so that it's happy, it's on our side, and it's producing the healthy things that we need. So would you like me to go more in detail with that, or let's up to you, whichever one you like?
I love it, and we have some time. I would love to, you spoke a little bit about the certain bacteria that causes acne, or that opportunistic, because I think it's always there, right? It exists, but again, like you said, when there's less diversity, it kind of tends to overtake and overthrow.
Yeah, exactly. They get a little excited and it starts to multiply. And what are some conditions that can cause it is, especially things like overwashing your skin or using really harsh cleansers. What it does actually is, first, it wipes out pretty much all the bacteria, right? Because it's kind of, those heavy cleansers have a lot of really harsh ingredients that kind of strip the skin. And it also, they tend to be more alkaline. So what I mean by alkaline is tends to be more of a basic nature. So our skin is acidic in nature. And acidity is actually a protection against bacteria, because acidity is a way to kind of control everything and keep all the bacteria populations in control. But when we overwash our skin, for example, or use really harsh cleansers, or even like soap, like direct soap, what it does is it decreases this acidity. So acne causing bacteria tends to thrive in less acidic environments. So that's why, if you use like improper face washes that are not pH balanced, you might be actually doing more harm than good to your skin if you're experiencing acne specifically.
Wow. Okay, so without throwing any kind of brand names under the bus,
okay.
Like, can you speak to some of the maybe more common like skincare products out there that we don't even know are bad or good, right? Or disruptive of our skin microbiome?
So always look for something called pH balanced on the cleanser or the moisturizer or whatever you're using. And also in the ingredient list, if you look for something that has like something called sodium laureth sulfate or sodium lauryl sulfate, so SLS, those tend to be more stripping. So they tend to just strip all the oils, everything of the skin. So they tend to be a little bit harsher. So look for those ingredients and look to see if it says pH balanced on the cleanser. And something else to kind of fix it, let's say if you are using one of these cleansers that is a little bit harsh is to use a toner that's a little bit more on the acidic side to kind of bring everything back into balance.
Okay, nice.
There's so many cool things and so many steps, you know.
Incredible. Yeah. I really need to up my skin washing game. And you mentioned direct soap on the skin isn't always good either.
Especially on the face, you know. Maybe on the body it's all right because the skin on the body is a little bit more resistant, it's a little bit stronger, it has more collagen, it has more of that yeah, it's just not as easy to be damaged as the one on our face. Our face is that's why, you know, we tend to show wrinkles mostly on our face instead of, you know, our bodies. So that's why try to stay away from soaps or like really harsh cleansers on your face.
Okay, and do you have any favorites that you can mention?
I do have some lines that I really like. I'm not sure if I can say it here, but I'll just say one skincare line. Not that I'm sponsored by them or anything.
Yeah, and please don't like take this as a recommendation for anybody.
Always spot test on yourself before. But I really like those affordable skincare lines that are still good quality, and they're, you know, ideally great for the earth and, you know, come from natural ingredients. So I personally love the Ordinary line. And Sukin, which is an Australian natural skincare brand. So those are products that I personally use for myself, but that's through many trial and error, you know. So definitely need to keep that in mind as well before you try anything. But what I like about these brands is it's more affordable, so you're not necessarily, you know, spending a lot of money onto these products, and they're great. They are really good ingredients in them.
Nice. Okay. Yeah. And also I like imagine that, you know, the microbiome from person to person, from skin to skin is a lot different and varied because, you know, everyone's eating differently and sweating differently and, you know, trying to detox a bit differently. So yeah, as Dr. Udani said, kind of like take it as a grain of salt and try it out because, you know, just because it's good for someone doesn't mean that it's good for everyone.
Yeah, and going on that, you know, let's say if somebody has dry skin more on the drier side, they probably want something a little bit more moisturizing. So like a lot more moisturizing ingredients compared to someone that has maybe more oilier skin. So like myself, I have more oily skin. So I tend to not use super heavy, super rich moisturizers. I tend to just stick with something a little bit on the lighter side.
And can you speak to what that, you know, what does heavy versus lighter kind of look like, or what is that like in ingredients maybe or something?
Yes, so they're called, so the heavier ingredients tend to be called occlusives because they tend to occlude the skin. So they tend to form a barrier, basically. So that's why it's so great for dry skin, because that barrier prevents excess water loss. Right? And that's what's causing the dry, peely, scaly skin. So some of these ingredients are shea butter, for example, some natural ingredients. Shea butter is great. Things like glycerin, things like jojoba oils, any kind of oil, facial oils that are a little bit high on oleic acid compared to linoleic acid. So this is another ratio that we can go a little bit more into depth. But look for something that tends to feel a little bit richer on the hand, tends to maybe leave a little bit of a film, like a barrier, so that you know that's what you need for skin that's on the drier side. For example, Vaseline can actually be great for dry skin. It is one ingredient. It is very it's from the earth. It's natural, but it's one of those ingredients that doesn't have added things like perfume or fragrance and things like that. So that could be great for dry skin as well. But always spot test so that you know it's good for your skin.
Wow. I'm curious to know, you know, what types of makeups folks are listening in are using and maybe what you've found to be better for your skin type.
Right.
And go ahead and just, put that in the comments there because I'm interested to know. I am not a makeup buff per se, as you can tell. But I like love getting to know, you know, what works for certain folks and what doesn't. And to speak to that, Dr. Udani, you know, in terms of actual makeup now, so like, you know, beyond the soaps and the moisturizers, is there, you know, certain things you should look for or something to avoid in your makeups?
Yes. So it's my belief, honestly, that you do not need fragrance in your makeup, because fragrance can be, especially if you have sensitive skin, it can be really harsh on your skin. It makes it actually can increase, it's called permeability of the skin. So the ability for products to enter into the skin is increased when you have fragrance. So it could be good or bad depending on what you're trying to do. So let's say if you're trying to put in like an active ingredient onto your skin, right? Things like, you know, like an eye cream or something. Maybe having a little bit of fragrance might not be a bad idea because you're really trying to penetrate it into the skin. But with makeup, you know, you're wearing it every day, but you're taking it off. So it's not really providing any kind of health benefit. So having fragrance doesn't really make too much sense to me. And I think it might even affect the price of that product. So not something that you want to spend those extra money for, you know, something you're taking off at the end of the day. In terms of if you mean by like skin textures, so for oilier skin, mineral makeup can be amazing because it's absorbing that excess oil. Liquid foundation can be great as well. So I personally use liquid foundation, and I try to stay away from cream-based foundations because it can, you know, be a little bit more, like I said, occlusive, so can form that barrier, so can help clog those oils trap the oils in the pores and make it more clogged. But it might be great for someone with dry skin, you know, because it adds that barrier. So someone with drier skin might not necessarily like the mineral makeup or loose powder because it can make the dry patches a little bit more visible. So they might prefer something like a liquid foundation that adds like an extra moisture factor into it.
Wow, you are a genius.
No, this is, you know,
amazing. There's so much knowledge, you know, that, you know, I have no idea about.
That's because you are your own natural. You don't need to wear anything, unlike myself and a lot of people out there.
Oh, I love it. And, you know, for folks just like curious about, you know, wanting to go a bit more natural, you know, what are some really good ways that they could do that? Really, you know, and I guess part of that is your daily routine. So like, you know, your things that you're using in the shower or in the, or the bathroom in general, right? So I was also curious because I do want to kind of bring it back to the digestive system a little bit. You know, some simple ways that we can, you know, kind of utilize around the house. You know, how can we really heal our skin from the inside in terms of food?
Perfect. So usually someone that experiences an imbalance in the skin tends to have an imbalance in their gut microbiome. That's, in my experience, that's what I've seen. So how I go about it and what someone else can, I really recommend speaking to a naturopathic doctor or a coach if you're really experiencing crazy digestive concerns and skin issues, because then that's really something to talk to a professional about before you try, because there's so many, you know, products out there, so many different diets out there, and a trained individual can really help pinpoint the one that's right for you. But something that I would do is I actually put my patients on a little bit of a cleanse first to get rid of the bad bacteria. So this can be antimicrobial spices, herbs, tinctures, and things like that. So at home, what you can do is you can try to incorporate more of the spices like oregano or garlic, a lot of turmeric, cloves, peppers. Those things are naturally antimicrobials. So incorporate that into your diet can help control any imbalanced bacteria that you might have. And then what you try to do is feed the good bacteria. So having fermented foods, having kimchi, things like sauerkraut, or things like kombucha, for example, or even, you know, natto, like fermented beans. And these things can really kind of boost the gut back to normal, and at the same time heal the lining as well. So something I have this amazing patient case where she came in with acne and really bad bloating, really bad fatigue, indigestion. And so always the first thing I did was target the digestion. And when that got fixed, her skin started to get better. She didn't have to try any prescription strength medication like Accutane, for example. That's one of the biggest drugs for acne. And her acne got so well that she is, she doesn't even have to think about that kind of stuff anymore. Wow. And then it all started in the gut. So making sure your gut is good means that your skin's gonna be gonna reflect that.
Mm-hmm. And yeah, I'm glad that you kind of brought that up, that there is a lot of, different diets and all, like, it's all the rage now, sugar-free and keto and whatever else. And it's important to follow up, check in first and then follow up with someone who's actually trained in this and not just kind of do it on your own, because it's also good, you need someone from the outside source to just look at you and like provide a witness for you to say, you know what, you may not see changes, but like this, and this is different now,
Exactly.
And I know that naturopathic doctors like yourself, Dr. Udani, talk a lot about bowel movements and how important they are. So I want to get into that a little bit. What's the kind of, I don't know, optimal number of bowel movements a day? And
So something I actually ask my patients is, I'll ask them, okay, how many times are you going to the washroom? And they'll say, 2-3 times. Then I ask them, okay, but do you feel like you're eliminating the amount of food that you ate during the day? Like, is the size of the poop equal what you ate? And sometimes they're saying, oh, you know what? I don't think it does. I feel like I'm just like kind of eliminating little clumps or whatever. Mm-hmm. So that's another huge thing, because bowel movements or pooping is the biggest way that your body eliminates the waste, right? Eliminates all the toxins, all those excess hormones, the bacterial parts, right? So if you're not eliminating, it tends to stay in your system. And that's why I always say, you have to make sure, doesn't matter how many times you go to the washroom, just make sure you're eliminating what you ate, So even if you're just having one really great, amazing bowel movement, that's great. But just make sure you're eliminating the same as what you usually put into your body. That's a good way that's a good marker.
Yeah, I like that better than, kind of aiming for something, because it's different for everyone as well. And we don't eat the same, right? We don't eat the same amount. And
exactly.
Some people, don't eat breakfast, or, only have 2 meals a day versus 3 or 4. Or some people like to snack.
Yeah.
A lot of different ways, but I appreciate that, that kind of marker of, okay, how much did you eat? Are you pooping that amount out, or are you not?
Yeah, exactly. And if you're not, then that might mean you just need something to bulk up that stool. So something like fiber, or maybe some supplementation like magnesium, for example, just to help you flush it out of your system.
That's a great thing to note, because actually I used to work as a birth doula, and one of the common questions after postpartum was a lot of people didn't, get back to normal with their bowel movements. And I remember one mother texting me and saying, I can't poop unless I drink a coffee per day, So bulking up, just really eating fiber is really important. I mean, not just for that time, but always.
Yes. And making sure you're drinking a lot of water, because if you eat a lot of fiber, you might notice you're a little bit more constipated. So you got to balance it out with more water, because fiber just like absorbs the water and gets bigger, and it helps to flush it out. So you need the water and the fiber together, and then have fun.
That's amazing. Thank you. And it's important to bring up these awkward topics, because, poop is really important. It's just another function that our body does and should be doing normally, right?
Oh my God, exactly. I think before I was a naturopathic doctor or naturopathic intern, I didn't even look at my poop. I was like, all right, I don't need to look at it anymore. It's gone, whatever. But now I really personally use it as a marker of how I'm feeling and how I'm doing. I I know this is too much information, but I actually feel really great when I have a good bowel movement.
Oh, you betcha. Who's snapping in the background? For sure. Same. It's like such a good, it's a better day, you know, when you have a good bowel movement.
You know, it is. You don't feel like you're bloated and holding things in. You're just like, hey, let it go.
Yeah, I love that. I love that. So we're nearing the close to the end, but I do have another topic that I want to bring up, which is pesticides and, you know, kind of removing some of that waste or like, you know, kind of toxic products out of our foods. And then just so everyone knows, we are going to have a Q&A as well. So I hope you've been jotting down your questions. Feel free to kind of pop them in the comments now. If you do have anything that has come up, and we'll take definitely like 5 or 10 minutes at the end to discuss any questions. So please write those in the comments as we finish up our last topic. So I wanted to ask Dr. Udani, you know, you have a lot of such good knowledge on so many different things. And what's something that, you know, someone at home, like we kind of talked about in terms of, you know, the bathroom products, what's something that we can do in the kitchen that might be really useful to help us with removing, you know, heavy metals or pesticides on our foods?
Right. And so this might come across as something might be random to some people because they might not think about pesticides as a huge cause of, you know, gut issues or skin issues. But so let me kind of explain why it's one of the hidden causes of inflammation. So pesticides are basically everywhere. You know, all the foods that we eat, unless they're organic, tends to have a lot of pesticides. So this is something really interesting that I found in a study, Erin, is that, you know, how so many people have gluten sensitivities these days. So what they found is it correlates with how much pesticide was used on wheat. So yeah, so as the amount of pesticides that rises on wheat, you see the same trend follows with gluten sensitivities.
No way.
Yeah. So what the agriculture industry usually do right before the wheat is harvested, they spray it with more like Roundup or glyphosate to, I guess, make sure it stays fresh. But then this glyphosate doesn't really get washed out of the wheat. So when we eat it, we ingest it with us. And because I mentioned, you know, the gut lining is only 1 cell layer thick, this glyphosate is a toxin. So it creates these holes in the gut. And this is really correlates with the increase in gluten sensitivities. And a lot of people don't really think about, you know, pesticides, don't think about gluten sensitivities, you know, and that's why if you tend to stay away from gluten, you get better, but you're also staying away from that pesticide exposure too, when you think about it. So pesticides come in all fruits and most fruits, vegetables, even the grains that we eat. And one of the best places to find out the highest, the number of foods that contain the highest amount of pesticides is the Environmental Working Group's Dirty Dozen or the Clean 15. So this gives you a list of the foods that have the most pesticides and foods that have the least pesticides. So a pesticide rinse is something that can eliminate the number of pesticides in the food. So this is something you can do at home. Let's say if it's especially hard for you to afford organic foods these days, you know, considering the times, and you know, something to reduce your exposure even more. And it's very easy, very simple. All you do is using about 2 or 3 tablespoons of baking soda in warm water, and you're submerging what are the fruits and vegetables in it for about 15 minutes. So the longer you do it, the more of these residues actually gets leached out of the surface of the fruits and the veggies into the water. So leave it as long as you can, ideally the 15 to 20 minutes, and it really helps to reduce those pesticide exposure. And that's one of the biggest things that I've really found with patients that are particularly harder cases, that, you know, they're still having gut issues, they're still getting bloated, even after we've done ABC, we've cut down the foods, we've given them, you know, probiotics and things like that. Just eliminating those pesticides can really help heal the gut more.
Wow.
Yeah. I know, it's crazy, right? It's like you think we're not necessarily, these gluten sensitivities might be, you know, actual genetic thing, but no, it can be because we're exposed to more of the pesticides. And I'd love to share that study with the audience if they like. I can send you the link and everything.
Of course, yeah, I can share it with the replay when I send it out to everybody. That is amazing, and it kind of just sparked my my thinking, because in Europe, I know some people that are gluten sensitive here, or even have celiac disease that go to Europe and they can eat.
Yeah, exactly.
and that is probably because Europe has a lot stricter and enforced laws on pesticide use in farming.
Most definitely. There's definitely these things where it's people that had gluten sensitivities or intolerances all of a sudden got better if they switched their diet in a different country.
Wow. Wow, incredible. Yeah, you just dropped a lot of knowledge bombs here. Wow, thank you so much. I am like so excited to ask questions like myself. Okay, just before we go into that as well, what's the most common question that people get when they walk into your office?
Most common question is, I would say, if they had a gut issue, basically, they're saying, I've been to ABC, I've not really noticed any help, anything changing, or I've been to my family doctor, for example, and, they haven't really told me what to do because I'm not at a level where I have polyps or I have crazy conditions. So they're like, okay, there's nothing really too much I can do. So a lot of people coming with needing answers. So yeah, so they basically say, what can you do, and how can you make me feel like I'm heard and I'm not just a number, and give me a plan. A lot of people, I think a lot of people feel a little bit lost, a lot of patients, and I personally would feel that way too. If I was a patient, I would want something that's like I know will give me the results.
Yes, and more foolproof, kind of like somebody that I can check in with, and also keep accountability, because I think we all like somewhat inherently know these things. There's simple, basic concepts. I mean, maybe not as in detail as what you described, but we're all trying to kind of avoid pesticides in our food. But we're like, oh, okay, I didn't know that washing it underwater didn't do the trick, kind of thing.
Right, exactly. And these are. And don't blame yourself or anything like that, and that's one of the things too, like you are doing the best that you can be at this moment. And there's always having an open mind to learning new things, and bettering yourself is the right way to do it, because there's really no right or wrong, I would say. You're on that journey of health wherever you are, and you're going to achieve your goals.
Yes. Great outlook. We all need that positivity. All right. So we're open to questions. I know I had one question, but I'll hold my tongue for a second while anybody else puts their questions up. And also, I guess while people are, thinking of questions and maybe jotting down anything, anything at all you can ask. It doesn't have to be related to your food or gut or skin.
Yeah, and if anything, feel free to send Erin and myself DMs on Instagram or email. Yeah, because we're here to help you, and we want to share the information with you guys.
Exactly, which leads me to what I was just going to ask you is, how can people further get in touch with you? Do you have a website? Do you have it? I know you have Instagram, but can you share it with the folks?
Yes, for sure. So you can get in touch with me. You can check my website out first to see, if you resonate with what I'm offering, the services that I offer. It's drudani.nd.com. So that's where you'll find my website and information about what kind of work I do and my process. And of course, Instagram is my hashtag is Dr Udani. And yeah, and then of course I can give you my email as well. So these are some of the ways that you can get in touch with me. Yes, I can.
Perfect. Sorry, I was just typing. I'll just type Dr. Udani's handle on Instagram into the chat so everyone sees it. It's Dr.Udani, right?
Yes, yes.
Okay, perfect. Perfect. Great.
I believe Hazel has a question.
Oh, great. Yeah, Hazel.
Yes. So she's
all right. So yeah, is there a probiotic that would be good for skin? That's a loaded question. Let's get into it.
Right. So probiotics that can be good for skin. So going for probiotics that are going to be anti-inflammatory in general will be great for skin. So these are, probiotics that have probiotic strains that have a lot of acidophilus, and bifidobacteria. These strains are really great because they're also commonly found on skin as well. So while by helping heal the gut, it's really helping heal the skin. And there's actually topical probiotics that you can put on the skin as well. So it's an up and coming industry where it's like skin creams containing probiotics that are like the industry is trying out now to really like get into the localized area to help with any kind of local inflammation. So they also contain lactobacillus acidophilus strains or bifidobacterium strains for the most part.
Yeah. Good to know. And Hazel, if you have like a more detailed question than that, feel free to ask, because I only preface that with, it's a loaded question because there's so many different probiotic strains out there and, different combinations of strains you can buy. And maybe that's something you can speak to, Dr. Udani, just from kind of like an overall general health perspective. Are taking probiotics good for someone? Should the everyday person kind of take some, or should we avoid it until we have some skin or gut issues?
I think it's good. I think it's good to take it as a preventative for sure. You can take probiotics as with a kind of general maintenance, because there are really good things that these bacteria can do in the body. Yes, for sure, you can use it specifically if you're, let's say, doing some antibiotics because antibiotics are just going to kill all the bacteria. And so to replenish that, you can have a probiotic maybe 2-3 hours after you take the antibiotic. So there's, like you said, you're right, there's so many. There's really probiotics with just like one strain, or there's probiotics that are multiple strains in one capsule. So it's really important to talk to a healthcare professional before you consider getting one, because really depends on your condition too. So there's one specifically for IBS, there's one specifically for things like eczema or psoriasis that might be better. So it's really good to talk to somebody. And I always say diet, try to add those great prebiotics, the good fermented foods into your diet, so that way you're already kind of feeding the bacteria you already have in your body.
Yeah, good. Yeah, it's always good to, just trial and error as well first on yourself, kind of on the things that you can control.
Exactly. And sometimes some people get bloating with using probiotics because, that's like too much bacteria all at once for them. So there's always a good and a bad. There's always that balance that, you have to kind of play around with it, and just speaking to a professional is a great way to start.
Great advice. Yeah. And as folks, come up with other questions, I'll ask one that I had myself, Dr. Udani, and it came up when we were talking about pesticide exposure. So I think you might have alluded to this, but does eating organic kind of mitigate the possibility of pesticide exposure, or is there some, should we still be doing the baking soda rinse on organic?
Gotcha. So when you do eat organic, make sure you know the source of the organic food, where it's coming from, because different countries have different guidelines for what is considered organic, right? Some countries might allow pesticides still, like a little exposure, and still consider organic. So ideally, let's say if it's coming from Canada or from the US and it's considered organic, then you would not need to use the pesticide rinse. So you should be okay without, without using that. But for any other kind of foods, I would recommend, especially for things like apples or kale. I used to eat kale so much, and it turns out it's number 3 on the dirty dozen list. So one of the vegetables that have the highest amount of pesticides. So now my family, we actually grow all the kale that we need in the garden, because we just realized it makes more sense to just have a home garden, And that's another great thing, in the summertime, having that vegetable garden, getting outside, and so you're getting this organic, fresh food right in your backyard. But to answer your question, if it is organic if it's been labeled by a reputable company, and it's sourced from, let's say, Canada or US, or even Europe, where the guidelines are more strict, you probably don't need to use a pesticide rinse for those foods.
Okay, good to know. Yeah, and like you're right, kale. Oh my God, it's one of the easiest things to grow. I love it. I grew up in Newfoundland, and kale, we only get like 1 month of sunlight there, 1 month of summer, and kale grows in a lot of different weathers. It's a hardy plant. So that's actually a really good point. And again, yeah, to look up that environmental working group, the Dirty Dozen, and I think it's, the Clean 15, right?
Yes, exactly. So that way, you don't need to, especially if the food that you're eating is on the Clean 15, maybe you don't need to necessarily buy organic if finances are a big thing for you. You can just use the pesticide rinse for that.
Yeah, case in point, strawberries.
Oh, yes. Strawberries, I believe they're high on the pesticide list, if I'm not mistaken.
Yeah, I think they're like pretty high up there, like same as kale. And so, whenever I see strawberries, I always ask, even if they're on the side of the road, kind of purchased from a farm, I always ask if, these are organic, or did you use pesticides? It's probably even better to, speak directly to the source.
Exactly. Yes.
For that.
Sure, yeah, those kind of things are organic, or as organic as possible.
Yes, exactly. Yeah. On the scale of 1 to 10, how organic is your produce? I love that. Okay. It seems that, the questions have kind of dwindled down. We'll kind of, I guess, take it from there. And I hope that you'll come back and do another webinar, Dr. Udani. This has been,
I'd love to.
Oh my goodness, we could have talked about so many more things, and we could have gone in a lot more depth of a lot of different things. So
yes,
I'm so happy to have you here. And again, for everyone that came and, was very interactive. This was a really good webinar. I really enjoyed hosting.
Thank you so much. I enjoyed being part of it. And thank you so much for being an amazing host and asking those awesome questions and trying to still, stop me if I was being too technical and, making sure everything was digestible.
Quote unquote digestible. I love that. And for everybody watching, thank you. Thank you for tuning in. I will be sending out the replay. So if you're on the email list, just send me a message either through Instagram. My Instagram is @TheErinEdwards, or you can send Dr. Udani, Dr.Udani on Instagram a message, and we will certainly get you this replay. But for everyone who already registered and is here right now, I will be sending out the replay tomorrow. So keep in touch for that. Keep connected, and we host webinars every Wednesday at 6 p.m. And like I said, Dr. Udani, it's been amazing. Please keep in touch with us, and we'll keep growing from here.
Amazing. Thank you so much for having me. I had so much fun. This is great.
All right. Stay beautiful.